Hello, this is Dr. Kelly Kramp. This short video is extremely important in learning the basics on how we're going to get your body back into health. The mission statement at my office is to enable every man, woman, and child to achieve their optimal health in mind, body, and spirit without the use of drugs and surgery. Achieving this through the chiropractic adjustment, education, and modeling of a healthy lifestyle. My goal is to ensure that your body has the ability to express optimal health. What I'm going to show you over the next few minutes is how this is possible. Now, there's really two ways of approaching health. If we look at the comic on the left, it says, "Are they playing overtime? You must be absolutely exhausted." Now, I like this comic because it's poking fun at human nature. This is what the majority of people are doing within our society. They are sitting there watching other people get healthy. And what ends up happening with this individual is that some sort of symptom will force him to make a healthcare decision. So the majority of patients will come to my office with some sort of symptom, whether it's neck pain, low back pain, carpal tunnel syndrome, headaches, whatever it is. This is what usually forces this individual to make a healthcare choice. However, what we know is the vast majority of our body we are unable to feel. In fact, we only feel about 10% of what goes on inside of us. So we can have underlying health issues and not even be aware of it. So there is another way to look at health. That way is that we need to build our body strong, healthy, and effective, like this lady over on the right. When we do that, we end up preventing a lot of the health problems to begin with. What I show patients how to do is what this lady is on the right doing. She's building a body that's strong, healthy, and effective so that it will take care of you as you age. But to start off with, what you need to know is that according to anatomy textbooks, every function of the human body is under the direct control of the nervous system. But you know this. Everybody knows this. Because essentially, what this is saying is that your brain runs every function within your body. The nervous system is quite literally the master system of the entire body. And when you look at where healing comes from, it's really easy to show you that your brain runs your body, right? Well, it's also really easy to show you that your brain controls and directs healing as well. So without the intelligence coming from your brain and traveling to your body will become weaker and weaker over time. I'll show you exactly how this works in a little bit, but first, here's a little quiz I'd like you to take. First question. It is possible that a person could have heart disease, cancer, high blood pressure, and yet not feel a symptom. True or false? What do you think? Well, the answer is true, right? If we look at heart disease as a primary example, we know that 40% of all people who die of a heart attack, the first symptom they get is that they die. That's the first symptom. What this means is that they could be walking around the day before thinking they are fine and healthy, but obviously they aren't fine and healthy. They are about to experience a major health crisis. Or cancer is another example. 80% of all cases of cancer, the patient will not feel any symptoms from the cancer itself right up until the end stage. So what this means is that the cancer could be building for years and the individual may not have any awareness of what is going on. Or how about this question? When a person has no symptoms, he is on the road to good health. True or false? Well, the answer is obviously false, because we know that we can feel no more than 10% of all the functions within our body. So what I always tell patients, and what is exactly important for you to know, is that symptoms are a horrible measuring stick of how healthy you are. I can have two patients with the exact same injury, and one will have a lot of pain, and the other may have little to no pain. You cannot determine health by symptoms alone. Symptoms are always your body's last resort to tell you something is wrong. Think about tooth pain as an example. A cavity isn't actually felt until it goes through the thick enamel and reaches the nerve. So you could have a mouthful of cavities, and if they haven't reached the nerve yet, you will have no pain. Or chest pains. Take this as an example. The artery needs to be severely occluded before chest pains are even noticed. This takes years of neglect and poor health to reach that point. Chest pains are always a late sign. The same goes for this cancer patient. This tumor takes months to years to grow. However, this was caught on a patient that was having a routine chest x-ray. They didn't even have lung pain or shortness of breath. So if we look to Webster's dictionary for a definition of health, what they give us is this: a condition of wholeness in which all of the organs are functioning 100% all the time. So really, it is your choice, because if you have a body with 100% optimal nervous system function, you're going to have 100% optimal health and healing. However, even if you have a 1% decrease in the function of your nervous system, then you will have a decreased ability to heal and to be healthy. The nervous system, remember, controls everything. So a decrease in function is going to cause all other systems to have a decrease as well. Unfortunately, what happens the majority of time within our society is that we run to the drugstore when we experience a symptom. But the symptom isn't the problem, right? It's merely the expression of the problem. People may take a Tylenol for a headache, but their body isn't deficient in Tylenol, right? The Tylenol only covers up the symptom temporarily. For proper healing, we must look to the cause of the problem, and that is exactly what we do at this office. I'll show you how that exactly works here in a bit, but first, there is a health line that exists within our healthcare system. And if we look at the traditional Western model of care, they like to deal between death and no symptoms. Now, if you're in a car accident, or you're in a life or death scenario, or you need your heart restarted, whatever it is, then our traditional model is where you need to be. However, where this model of care really fails is when you get between symptoms and no symptoms, because people will receive a drug to manage a symptom and not correct the cause, and they eventually fall out of the healthcare system. Now, this is where chiropractic really takes the forefront in health and wellness, because what we are able to do is to take people out of the symptomatic phase and eliminate their symptoms. Then we continue to help them past any energy problems like fatigue, or past feeling okay, up to feeling great, and even having a zest for life. And truth be told, the majority of patients in my office right now are enjoying being part of that group in the far right, instead of watching the majority of society fighting off in the far left of this continuum. The reason why this happens is because medicine and chiropractic have two vastly different paradigms of thinking. Medical doctors are like firefighters, and chiropractors are like carpenters. If your house is on fire, you need to have a firefighter come in and knock down walls and hose it down with water and chemical extinguishers to eliminate the immediate threat. But how much sense does it make to have those same firefighters in your home when there is no fire? They will be knocking down walls and flooding your home for no good reason. This is where the carpenter comes in. The carpenter will rebuild that house that has fire damage. The carpenter will build a home sturdy and durable and efficient. The same is with a chiropractor in your body. We take the body and allow it to be as healthy as possible by building it strong, healthy, and effective. This way of thinking is allowing for the body to become as healthy as possible. Now let's take a moment and think about what's important for us to sustain life. There are 4 essentials arranged in a hierarchy for us to sustain life and good health. The first is food. If I said to someone to go without food, they may live roughly 60 days. If I said not to drink any water, they may live 6 or 7 days. If I said don't breathe, they may live only 3 or 4 minutes. But then, if I said to go without a nerve supply, they will live literally less than 1 minute, 0 minutes, and it's literally less than a second. Your body cannot function without a nerve supply. This is the exact reason why if you break your spine above a certain level, you are instantly dead. Your brain needs to coordinate life through that nerve supply. So you can see from an order of importance what is the most important in health. People don't think of having food to eat if they don't have air to breathe, right? And in the same respect, people should not think of having good water to drink if they don't have good nerve supply. The only problem with this scenario is that you are not designed to feel nerve supply, whereas you are designed to feel if you're hungry, thirsty, or you need to breathe. So what this means is that you could have terrible nerve flow right now to every cell, tissue, and organ in your body and not even have a conscious awareness of it. This is why it is critical that we do a thorough examination and measure the nerve function through our technology on your nervous system. I want to see exactly how your body is functioning, whether you feel it or not. Now, in that nerve supply, there's an intelligence. We call it an innate intelligence or a life force or a soul. It doesn't really matter what we call it. It's obvious there's an intelligence that allows you to walk, talk, and breathe, to regenerate and to heal. It's what that separates the living from the dead. Without it, our bodies become weaker and weaker over time. Even medical doctors now are starting to say that our inner intelligence is far superior to any substitute from the outside. Now, let's look at subluxation. This is exactly what I'm looking to detect and correct within your spine each and every time you come into my office. So what is a subluxation? Well, a subluxation is quite literally a misalignment or dysfunction of the spine causing irritation or interference of the nervous system. It literally blocks the message from your brain going to your body. When I ask people where they think sickness comes from, the answer I most often get are things like bacteria, viruses, or maybe even some bad luck. But I want to change your thinking on this a little. If I was sitting in an auditorium full of people and I opened a jar of germs and waved them around, some people would get sick and some wouldn't, right? That's just the way it works. So it can't be about the bacteria and viruses because people get sick at different rates. So it's got to be about the strength of your body and the strength of your immune system and the strength of your nervous system telling your immune system how to work. What this tells us is that we do have a choice in how healthy we are. We just need to be proactive. We need to build our body strong, healthy, and effective. If we don't, then we have to admit that we are increasing our health risk over time. So, could subluxation cause a weakened body? Well, remember that subluxation blocks crucial nerve messages traveling from your brain to the body, and some of those nerve messages we know tells your immune system how to work. So logic simply says yes, it can produce a weakened state of health. But the nice thing now is that research is showing this to be true as well. Research now shows that chiropractic patients have up to a 200% stronger immune system than non-chiropractic patients. So you do have a say in how healthy you can be. The way that the body works is that it needs to send messages down the spine, through the nervous system, and to every cell, tissue, and organ in your body. But what if there was some interference in that nervous system? We know that you have over 60 trillion cells, and if one of them doesn't get the nerve supply it needs, it becomes dysfunctional, diseased, or can even die off. Now obviously, you can't feel 60 trillion cells. However, even if one of them doesn't get the nerve supply it needs, I'm sure that's something you would like to know about. Let's use the stomach as an example. The nerve that supplies the stomach comes from the mid-back region. If there is a subluxation and nerve blockage of that region, it's going to cause dysfunction, usually in the form of heartburn or indigestion. I have many patients that have seen me solely for the fact that they have heartburn, and we get great results. The reason why is because once we remove the interference from the nerve and it is able to fully heal, and the message from the brain to the stomach is fully received. The sphincter separating the stomach and esophagus is able to close fully, and it stops the reflux of the acid into the esophagus. The solution should never be to slow down the acid production of the stomach by using drugs, because that's simply not fixing a problem. That's just simply hiding it. Here at this office, we are always looking to find the cause of the problem. So what causes subluxations? Well, every single day, we are putting our bodies through stress and trauma that our spines were never designed to endure on a repetitive basis. Things like lifting improperly, sitting at a computer desk, lying on a couch with your head propped up, holding a phone between your head and your ear, the falls we experience every day, reading in bed, and even the birthing process we know can cause subluxations. Think of all the slips, trips, motor vehicle accidents, that happen. We are putting our spines under so much more stress than we were ever designed to endure. But it's not just the physical stresses, but it's the emotional, mental, and chemical stresses also that play a role in decreasing your body's ability to heal. Everything from the foods we eat, to the way we feel, to the drugs we put into our bodies. We are under an immense amount of stress, and all of this affects your nervous system's ability to heal. This is the reason why at this office we take a very holistic approach to health. We look at the whole body so you can live with optimal health. Now, if we look at the spine and the way it should look, we can see from the front and back, it should be straight up and down. And from the side view, it should have 3 smooth continuous curves. It has this shape because the spine actually functions as a spring. With every step, every lift, every impact, the spine has a springy action protecting the bones, discs, and nerves. If for whatever reason the spine loses this normal shape, there is going to be some health issues. Let's take a look at a couple examples for you. You can see in this view that as the spine bends to the side, the nerves are obviously going to be irritated. Those nerves can cause pain and dysfunction in the muscles of the lower back and down into the leg. However, what most people don't realize is that those exact same nerves goes to the bladder, the intestinal system, and the reproductive system, telling them all how to work. It's the same idea in the neck. If it bends to the side, the nerves are going to be irritated, and these nerves are known to not only affect the muscles of the neck, but also the lungs, different glands in around the neck and head, and also the immune system. So let's take a look at typical degeneration or decay stages that people's spines can undergo. On the side view, we should have a nice, smooth, continuous curve. If we lose that curve, we have likely entered into a phase 1 of degeneration or decay. In a phase 1, it's like we've taken that curve and pushed it straight back. When this happens, the spinal cord that runs within the spine needs to stretch and lengthen. And research has shown it can stretch and lengthen up to 5 to 7 centimeters, even though the spine is not elastic. And that spinal cord, we know, functions on tone, which means that the more stretch that happens, the more dysfunction you have with your health. So health problems can definitely happen in a phase 1. But if this is left like this without having chiropractic care, it will progress to a phase 2. In a phase 2, health problems are increased, more health problems exist. We also start to see a loss of disc space and abnormal bone growth. And if this is left to continue, it will progress to a phase 3. Phase 3 is end-stage arthritis, and you can see how much of a mess this neck is in. Research has also shown that unfortunately if somebody reaches a phase 3, it's simply gone too far for a chiropractor to reverse the changes. At best, we moderate their pain. This is why I'm very serious about the plan of care that I give you, because not only do I want to stop the degenerative process within your spine, but I also want to reverse it as much as possible. With proper care, we are able to restore that curve and allow it to decrease the stress on your nervous system. This is what it looks like over time. This individual starts with a nice healthy curve, but because of the stress and strains of life that they start to lose their healthy curve and they enter into phase 1. And as that progresses, we start to see some abnormal bone growth appearing. We also start to see loss of disc space. This individual has entered a phase 2. And as that progresses, we see this person entering even into a phase 3. Now, to be honest, this person is probably in their 80s and have spent their lives not maintaining the structural integrity of their spines. However, I've seen people in their 50s with spines like this. The more stress and abuse that is put on the spine, the quicker the degeneration that is seen, and these people, we know, do not live as long. Now here's a prime example of an individual who needs chiropractic care. This is Devin. He presented with headaches and breathing problems. As you can see Devin's posture. Well, you take a look at the before picture. The green line is where he should be, but the red line is where he is. And after a course of chiropractic corrective care, you can see the dramatic improvements. He just looks healthier, doesn't he? Even the function of his lungs looks healthier. his headaches went away and his breathing problems went away. You can see the physical changes that were made in his neck as well. And a Nobel Prize winner, Dr. Roger Sperry, he showed us that with his research, 90% of your brain's energy goes towards posture alone, which shows you how important it is for health. It's also a reason why we commonly see that chiropractic patients see an increase in their energy levels. Because as we allow the spine to maintain posture effectively, the brain doesn't need to spend as much energy recruiting muscles to hold that posture in proper alignment. I get asked all the time what chiropractic can help. And as a chiropractor, I remove the interference of your nervous system and I allow the body to function the way it is designed to. When we do, we see a multiple of symptoms disappear. In our office, we commonly see things like colic, immune weakness, headaches, neck pain, low back pain, heartburn, carpal tunnel syndrome, sleeping problems, vertigo, whiplash, menstrual pain, indigestion, constipation, bedwetting, ADHD, sciatica, fatigue, blood pressure, and so much more. We've had phenomenal results with all of these issues and more. But in order for you to heal, there are 3 stages of healing that we need to listen to. The first is called the acute inflammatory stage. This is when people come into my office under immense pain, and we just need to calm down the nerves so we can start repairing the spinal dysfunction. So the next critical stage becomes the repair stage. This is where we release the nerve pressure, and we get the nervous system healing properly. Symptoms will disappear through this stage, and energy levels increase dramatically. Quite often, when people get to the end of the stage, they feel so good, they will say to me, "Why do I still need to come in?" And the answer is that just because we've repaired spinal function doesn't mean we've remodeled the spine. So if we stop care here, there's no reason why the spine just won't return back to exactly where it was. So this next critical step is the process that we call the remodeling stage. This is where we get rid of the problem once and for all. The best analogy I have is braces on teeth. With braces on teeth, it takes time, right? We know that can take up to a 2-year or sometimes longer period for them to be properly aligned. With chiropractic care, we can make significant changes within a 12-month period. So for that reason, all corrective care recommendations are based on a 12-month schedule. What you want to do with those recommendations is up to you. Whether you choose just to remove symptoms or you choose to build your body healthy and correct problems, that's your choice. I respect your choice. After the remodeling stage comes the idea of wellness or maintenance. And that idea is quite simple. Once you have your spine and your nervous system functioning at its best, you'd want to keep it there, right? It's not hard to do, and I'll certainly teach you how to do that very simply as we get to that stage. Now, it's your choice. However you want to approach health is up to you. On your next visit, I'll go over specific results and your recommendations. It's your life, live it in health. I'll see you in the office.